Hi, I'm Brenda from Openended Care. I'm one of the care queens with Nancy. Today we're going to do just to briefly talk about anxiety and agitation for the hospice patient. Anxiety is a good human natural response. We all have it, and it's usually telling us do something, change something. What most of us often do is we get busy and distract, which is just being human. When somebody's facing their end-of-life process, they know they're dying, it's a normal, good, healthy response to have some anxiety about that for lots of different reasons. Most people worry less about actually being dead than they do the dying process. And honestly, it's not even the physical part. We're really good at managing physical symptoms when somebody's dying. It's about letting go of control, physically, emotionally, mentally. And that's where, if we haven't practiced that letting go of control, we tend to have more anxiety. And it's true for all of us. With anxiety and agitation, we do our very best on hospice to help manage that. But oftentimes, especially for family members, we can't fix all of it. But we can help. But the biggest thing we can do is we can be present, we can witness, we can be there. And that's often the biggest comfort measure that there is. And the other thing is it helps to have some acceptance for anxiety and agitation when we realize all of us, but the only thing I've really learned over all these years is we all die like we live. And if we're a calm, patient, accepting person, our death goes that way. If we're a round up, dramatic person, we're gonna have that death. That's not bad, either one, because there's comfort in being who we are, even if it's dysfunctional. So I'm going to go through the care plan, our section on anxiety, agitation, briefly talk about it. The goal is to recognize the signs of emotional and physical anxiety and agitation, and to enjoy adequate and consistent sleep. What to know? Anxiety is normal and expected, as we talked about. Anxiety can be caused by pain. Pain can cause anxiety. They tend to feed each other. So overall, good symptom management and pain management is super important to help keep anxiety down. If you're physically distressed with any other symptom, your anxiety level goes up. Your body is telling you fix something. If you can't breathe, the number one response to not being able to breathe is anxiety. It's normal as our life bubble starts to shrink and we get closer to dying, that we get forgetful and we can't remember. That causes anxiety. What's important is to recognize signs of anxiety. It can be very subtle and hard to see. For some people, they just get agitated, they can't sit still, they're perseverating on something, they just look worried. Irritability is a big one, not remembering. Or just not being themselves. And also and lots of people, especially older generation, they don't like to think of themselves as anxious because we kind of think of it as a bad thing, but anxiety is actually a good thing. But using different words, are you fretting? Are you worrying? What's that itching under your skin? Signs of agitation, it's kind of the next level up. I can't sit still, I'm up and down, I'm picking at things. At this point, and at some points of anxiety, we want to do things about that. So what are some things we can do? First of all, make sure that all the physical needs are met. Do they have to urinate? As we get older, we get closer to dying, we sometimes can't recognize there's sometimes urinary retention. Constipation is a common one. And so there's not being able to urinate or needing to urinate and not being able to get up, that is a huge anxiety producing. Being constipated, needing a bowel movement, not being able to get up, not being able to recognize, that's very anxiety producing. So make sure that they're on a good bowel and bladder program. There's also a section on those in the care plan about that. So, are they thirsty? Are they hungry? Are they hot? Are they cold? Remember, life is full circle, and as people are coming into their dying process, they're going to have to rely on us to take care of them. So stand back and look at them. Are they comfortable? Are they wadded up in the sheets? Are they crumpled in bed? Make sure that all their physical needs have been met. Keep their mouth moist and clean, whatever it is. And then really make space for listening, open-ended questions, Like, I see that you're anxious. Is there something you want to talk about or not talk about? In hospice, we use the terms wish, worry, and wonder. I wish you weren't feeling so anxious and worried. I'm worried that if your anxiety level keeps escalating, you're going to become very uncomfortable. You're not going to be able to sleep, and we all want you to be calm. I wonder if there's something we can do about it. I wonder, do you need anything? And when you've gone through all the steps of checking all their physical, emotional needs, checking in, and realizing you can't fix it necessarily, and sometimes it's a state. Talk to your hospice. It is very common to have some soothing medication in hospice. There's a lot of different medications depending on your hospice, how they prescribe it. And what I often tell people is, don't wait until anxiety has swirled out of control. It's expected to have some anxiety. Use some medication beforehand, expect it, maybe schedule small doses. Doing that, you often use less medication when you anticipate a symptom rather than waiting until the symptom's out of control. If these medications and these interventions haven't helped, you're at home with your loved one and it's not working, call hospice. They're going to likely give you some information over the phone. If they can't do that, and it's been a couple of times, they'll likely make a visit. So again, dying is a profound, hard process, physically, emotionally, spiritually, both coming into the world and going out. There's similarities, and there's some anxiety with it, and it's to be expected. Trust it, address it, and have comfort in just knowing that you're going to die like you live, and you're going to find your way. Thank you.